It is estimated 13.5 million people around the world use opiates. There's a link between oxycodone and heroin use. Today we will be discussing pain, oxycodone, and the link between oxycodone and heroin use. What is pain? Pain is what we experience when a signal gets sent to our brain that something isn't right. Pain is a triggered response from our body to our brain. How our body naturally reacts to pain is by releasing a chemical called dopamine. This chemical, otherwise known as the love drug, gives us a feeling of euphoria. When we have pain that can't be controlled by our bodies, we use medication to help alleviate the pain. Our doctors can prescribe these medications to help with pain management. Oxycodone is one of the medications doctors can prescribe. This drug is labeled as an opiate. If the name sounds familiar, it should. It is a derivative of opium. This is prescribed by doctors for the short and long-term pain management. Many patients have to up dosages to maintain the same level of relief as the body becomes accustomed to the drug. Prolonged use leads to chemical dependency. Enter the link to heroin use. How? Heroin is opium-based too. The CDC has claimed the strongest risk factor for heroin addiction comes from addiction to opiate-based painkillers. When we take these medications, our body stops making dopamine to prevent an overdose. By altering our brain's ability to produce dopamine on its own, we can no longer alleviate pain on our own and have become chemically dependent. With the crackdown of this drug, many are resorting to heroin. It's easy to find and cheaper as well. These patients are chemically dependent on the drug and need it or they will withdraw. With prolonged use, the brain changes so the patient can't quit using the medication on their own. There's a link between oxycodone and heroin use. The use of the opiate-based pain medications can lead to heroin use.